Today we are going to see about the temporomandibular joint. So what is the TMJ joint? A joint between the temporal bone of the skull above and head of the mandible below. So the mandible has basically two heads. The head articulates on each side with temporal bone of the cranium. TBC is temporal bone of the cranium. The TMJ joint allows the movements of the mandible for speech and mastication. It is a synovial type of joint that is atypical. Next we will see about the articular surfaces. It has two articular surfaces, upper and lower. The upper articular surface is formed by the AE means articular eminence and AF means articular fossa. Then the lower articular surface is formed by the head of the mandible, which I have represented as HOM. Next we will see about the joint cavity. The joint cavity of the TMJ is divided into upper compartment and lower compartment by intra-articular disc of fibrocartilage. The upper compartment is called as meniscotemporal, which provides gliding movement. Lower is called as meniscomandibular, which provides gliding plus rotation. Next is articular disc, which is an oval plate of fibrocartilage. It has more collagen fibers. It is congruent with both the articular surfaces. It has two surfaces, right? Upper and inferior. The upper is concave or convex, inferior is concave. The upper surface fits against the AE and AF, that is articular eminence and fossa. Concave fits against the HOM, head of the mandible. Now see the diagram. The periphery of the disc is thickened, right? It has a thick margin that is called as the peripheral annulus, and the periphery of the disc is attached firmly to the fibrous capsule. And on sagittal section, it is divided into two by a thin intermediate zone. It has two bands, anterior band and posterior band. The anterior band is continuous with the lateral pterygoid. The posterior band has two laminas, upper and lower. The upper lamina is a fibroelastic tissue and the lower is a non-fibrous elastic tissue. The upper lamina, it is attached to the squamotympanic fissure, and lower one is attached to the back of condyle. In sagittal section, the articular disc has 5 parts: anterior extension, anterior thick band, intermediate zone, posterior thick band, posterior bilaminar zone. Now ligaments. There are 4 ligaments: fibrous capsule, lateral ligament, that is the temporomandibular, spinomandibular and stylomandibular ligament. So the fibrous capsule, it is the fibrous sac to enclose the joint cavity. It is attached above to the AF, that is the articular fossa, and STF, that is squamotympanic fissure. Then lateral ligament is the temporomandibular ligament. It is a true ligament. It is the thickened portion of the capsular ligament. Mandibular ligament, it is attached above to the spine of sphenoid and below to the mandibular foramen of the mandible. It represents the unossified intermediate part of the sheath of Meckel's cartilage. Stylomandibular ligament, it is attached above to the styloid process and below to the angle and posterior border of ramus of the mandible. Next is relations: lateral, medial, anterior, posterior and above. Laterally, it is skin, fascia, parotid gland, temporal branch of facial nerve. Medially, ATN means auricular temporal nerve, CTN means chordotympanic nerve, MMA means middle meningeal artery, then spinomandibular ligament. Anteriorly, lateral pterygoid, then masseteric nerve. Posteriorly, auricular temporal nerve, superficial temporal vessels and external aortic meatus. Then above, by the floor of middle cranial fossa. Take a look at the nerve supply, blood supply and lymphatic drainage I have mentioned below. Next is stability. The joint is more stable when the mouth is closed when compared when it is open. Next we will see the movements of the mandible. For lower jaw, there is 2 basic movements, gliding and rotational, that we can be divided into two compartments, right? Upper meniscotemporal, lower meniscotemporal. For upper meniscotemporal, remember GPCR, G for gliding, P for protraction, C for chewing, R for retraction. And in lower, there is 2 axes, transverse and vertical. Transverse, E plus D. E means elevation plus depression. SS means side to side chewing. The movements occurring at TMJ are depression caused by lateral pterygoid, elevation caused by temporalis, masseter and medial pterygoid, protraction caused by both medial and lateral pterygoid, retraction by temporalis, and side to side movements by medial and lateral pterygoid, that is contracting alternatively. So to summarize, the elevation And retraction is caused by the common muscle temporalis, and protraction side to side is caused by the contraction of medial and lateral pterygoids. Finally, we will know about the muscles of mastication. There are two types of muscles, principal and accessory. First, we will know the principal, that is TMLM. T for temporalis, M for masseter, L for lateral pterygoid, M for medial pterygoid. All the muscles of, that is the principal muscles of mastication, are located in ITF, that is infratemporal fossa, and are inserted into ramus of the mandible, that is ROM, and the nerve is trigeminal nerve. The accessory muscles of mastication are digastric, buccinator, mylohyoid, and geniohyoid.